Hi, I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys, so that you can have a healthier, more informed pregnancy.
In today's episode, I talk to renowned Eastern medicine practitioner and holistic fertility coach, Dr. Juli Yelnick, who returns to help us rethink what a diagnosis of low egg quality or reserve really means for women trying to conceive. If you've ever felt overwhelmed by a diagnosis or frustrated by the lack of answers, told that donor eggs are your only option, this conversation is for you. Because in this episode, Dr. Juli challenges the often limiting narratives of Western medicine and shares how traditional Chinese medicine offers an ancient perspective, one that focuses on understanding the root causes behind these conditions and empowers you with practical, individualized strategies for healing and hope. We'll explore the most common patterns of imbalance that impact egg quality and ovarian function. Learn how to recognize these patterns in your body and discover the 5 branches of traditional Chinese medicine that can help restore balance and open the door to natural conception. Juli, thank you so much for your time today. It's fantastic to have you here with us.
Thank you so much for having me back. Our discussions are so insightful and stimulating. I can't wait to do it again.
Thank you once again for sharing so generously, not only of your time, but of your incredible wealth of knowledge around women's health and its impact on fertility, pregnancy, and especially from an Eastern medicine perspective. And today is another incredible episode around low egg reserve and low egg quality, which is something that really does impact many women. And I guess let's start from more of a Western medicine perspective. So for people who might not be super familiar, can we talk about what low egg reserve and low egg quality mean from that Western medical perspective? What would be the main signs, symptoms, and I guess diagnostic criteria?
Yeah, sure, absolutely. And this is a topic that sort of encapsulates some subtopics. So I guess I would start with talking about primary ovarian insufficiency, or POI. This is the most specific of the diagnoses that someone can get that's based on the things that you just referred to. So this is sometimes called premature ovarian failure, or even like it's compared to being in early menopause. So basically this means if you don't have your periods and you're under 40 years old and they're finding that you're not ovulating, then that's the diagnosis. That's the criteria. So basically, if you don't have normal ovarian function and you're under 40, they'll call this primary ovarian insufficiency or premature ovarian failure. You can also get terms in there, diminished ovarian reserve, which has a lot more to do with the egg numbers specifically than it does the ovary function. But these things are so intermeshed that you usually see these types of diagnoses or conditions listed in the same discussion, which is why I wanted to weave in some information about all of them in it today at once. But basically, a woman might go in looking for answers about this if they're noticing, again, that their periods are very irregular or they're not having periods at all. They might do some hormone testing for this, and they might see things like low estrogen, or certain types of estrogen are super lower than they're supposed to be. They might have high FSH. So if you see like extremely high FSH levels, your body is like, what is going on? We're trying to ovulate and you're not ovulating. Like, what the messages become very mixed in your body, and that can show up that way on lab tests. You often will get low AMH as a result in your lab testing, which talks more about, again, the eggs that you have left that they think might be maturing and you might be able to ovulate them later, but they're not sure. So all these things are very wishy-washy, in other words. So there's not one exact test that can say, do you have primary ovarian insufficiency? Just like when women who are in perimenopause go into the doctor and they're like, test me, am I in perimenopause? And the doctor has to say, there's not a test for that exactly. We can check your hormone levels at various times of the month if they're really willing to go into depth like that, which most are not. But there's not just one definitive factor. So we In traditional Chinese medicine, we get to look at the why this is happening, and that helps to explain why your ovaries either are not functioning, why your egg reserves seem to be diminished. As we all know, we are born with all the eggs that we will ever have. So when we're born, we might have 1,000,000 eggs on our ovaries. And by the time we are of reproductive age, we might be down to 300,000, which still sounds like an astronomically higher number than we would ever need, right? Which it is. But we can start to see even lower numbers hinted at. And ultimately, it doesn't matter how many you have. We only need the one each month. We only need a few to have a few children. So really, the number is not my concern. It's the quality that's my concern. And when I see women coming in to my fertility practice or my fertility coaching group now, and they're saying, the doctor told me I have to have an egg donor because my egg reserves are low, or my eggs are poor quality, or they don't even think I'm ovulating at all. All of those types of things would be what a doctor would tell you or what a woman would tell me is going on with them. And ultimately, those statements can be what's going on, but they aren't getting into the why. So for me and for traditional Chinese medicine, we are always so much more focused on the why. Why are you not ovulating? Why are your ovaries not doing this function every month? Why is one follicle not becoming dominant enough to fully develop that egg and then release it for effective conception and implantation? Why? I just want to always track it back. So in Western medicine, they don't really have a why. The most common reason they give you is just idiopathic. We don't know what the cause is. Maybe it's genetics. Maybe it's an autoimmune function where your body is attacking your ovaries and not allowing them to do their job. Certainly, if you've had chemo or radiation or certain procedures or taken certain medications that we know can damage the very sensitive reproductive cells that we have, that can be a reason too. Of course, if you're missing an ovary or two, or if you're missing a fallopian tube or two, these structural issues would really explain this. But most of the time, there's not a clear answer. There's not a clear structural issue. But unfortunately, Western medicine leaves it at that and says, we're not really sure why, but we also don't really have one effective treatment to restore your ovaries to optimal function. So you should probably look to getting an egg donor if you want to have a baby. End of story. Unfortunately, that's the end of story for most women. But fortunately, if they find us in traditional Chinese medicine, that's just the beginning of the story. And then we can go from there to figure out why it's going on and then to give them the things that can resolve that and really help restore function to the ovaries and help to really improve egg quality as well.
It all comes back to that why, doesn't it? And I feel like there's some people that are okay with not knowing the why. And then there's other people that are like me. That's why this resonates with me so much, because I've always been, I want to know why. Like, why is this happening? I don't know what it is. I must be just super inquisitive and want to know why. And then the next question is, okay, what can I do about it? And I think there's obviously people that are okay not understanding the why of things. And there are other people that maybe would gravitate more to what you're talking about that want to understand why and what can I do about it. So if we're talking about this from Eastern medicine perspective, if someone comes to you being diagnosed with low egg reserve or poor egg quality, how would you approach that from a traditional Chinese medicine perspective?
Yeah, I think that it goes to the exact words that you use. There's the what, the why, and the how. So like you said, a lot of women will come in and they'll say, this is what I have. This is my diagnosis, one of those things. And then those who want to learn the why did this happen? Why is this developing this way or not working this way? And then that third step is the how do I resolve it? So truly in my fertility coaching work now in my practice, I want to work with the women who want to do all three of those, not just the what it is, why did this happen, and how can we resolve it? So when someone is willing to go through those three questions, all three levels like that with me, that's where I can really help them, because there are no Band-Aid quick fixes for us in traditional Chinese medicine. It is always about getting to the root of the problem, figuring out which imbalance caused this presentation or this manifestation in your body that led to that diagnosis, and then what we can do to resolve it and improve it. So it'll absolutely depend on which pattern of imbalance has caused their egg quality to be poor or has caused their ovaries to not be as functional each month as they should be. So I can give you the top couple of reasons or imbalances that would cause these things in women, and then those will definitely determine how we would go about resolving them. Okay, so the first type that we would say that of a person who would have this condition would be someone who is liver blood deficient. So if you have a blood deficiency, you don't have enough blood, especially call it liver blood, that will not nourish your eggs and they won't develop. So each month, your ovary is supposed to say, I've got one of these follicles. That's the dominant one. We're going to really focus our energy on developing that one really well. And that's the one that we're going to ovulate for you. If there's a blood deficiency, there's just not enough nourishment to the ovary in general and to the egg specifically or to the follicle sac. So there's nothing happening that's supposed to be happening because it just doesn't have enough raw materials to make something out of or to grow something out of. This person will also have other signs in their menstrual cycle or in their reproductive organs that might give us the clue that liver blood deficiency is their pattern of imbalance that's creating these problems. To go to the period side of the month, we would see very little, or we call it scanty bleeding. So maybe this is the person who only bleeds like 1 or 2 days for their period. And they're like, oh, I guess it's light. Is that okay? And they'll be asking those questions. They'll be like, is it okay if I only bleed for 1 or 2 days? Or how much blood am I supposed to have for a normal healthy period? Because I think I only have this much. Or I can just wear one pad all day. Or I only change the cup once. Those are all the signs that you're going to get from someone who might have liver blood deficiency. They're not bleeding a lot. And that goes back a step to their uterine lining is not developing fully enough. It's the same situation all 3 parts of the month, right? So it's not enough blood to nourish the egg. It's not enough blood to nourish a uterine lining that has to grow each month from scratch, essentially. So we want it to be nice and thick to support implantation and then to have enough there to also then grow a placenta as well, along with the baby. If there's not enough blood, none of those things can happen inside the uterus. And then when it comes time for your period, if you don't have enough blood, that built up as tissue, you're not going to bleed very much. So we see it through the whole monthly cycle. There are other things I can have you look for that are outside of your reproductive organ and cycle that can also be clues that you are liver blood deficient as one of your main patterns of imbalance as a human. So that would look like on your tongue. If you look at your tongue, we use tongue diagnosis for pretty much everything in traditional Chinese medicine. But if your tongue is very pale colored, that's the biggest sign. Specifically on the sides of your tongue, that correlates to the liver in particular. So if the sides of your tongue are really pale or more pale than the rest of your tongue, that's a big sign. If your whole tongue is really pale, that's another sign. The other things around the body would be very much about like your energy levels. So this is one of those times where Eastern medicine and Western medicine can agree on the same thing. Like anemia is a thing of low blood, right? In some ways. And then blood deficiency, that's the same thing. And we would both agree that person would be fatigued, have low energy. We specifically add to that and say that this would be someone who has like a POTS presentation or who simply gets dizzy or lightheaded when they stand up. You might be someone who has the floaters and sparkly things in your line of sight or just blurry vision, like weak vision. So eyes are heavily implicated there. The liver is very closely tied to the eyes, and that's why the eyes are affected and vision is affected. The memory is usually poor. If you don't have enough blood, then it doesn't nourish the brain and you can't have your memory's not as sharp. Like word recall really suffers, things like that. Well, liver blood deficiency can show in so many ways that this is usually something we can figure out pretty quickly. It shows all over the body. Like you'll have dry skin and then your skin will be so dry that it's itchy for no reason. That's a huge sign. We're like, liver blood deficiency. Let me see your tongue. And then we ask about the period and then we know it's liver blood deficiency. Another pattern of imbalance that someone would have very commonly leading to these types of ovarian or egg diagnoses would be kidney yin deficiency. So in traditional Chinese medicine, the kidney organ, the whole kidney system, it is like in control, in charge, governs all reproduction. So it's a big organ system for us whenever we're looking at things related to fertility in general. So one of the imbalances that the kidney can have or develop is the kidney yin can become deficient. So if you have kidney yin deficiency, you're basically so dried out, there's not enough moisture in your body that you'll have a very specific looking tongue as well. Your tongue will be very small. It's usually red, like a kind of a darker, brighter red. And it's usually full of little cracks, little cracks that go this way, not the big centered long one, but the other way. You'll have little cracks and a red tongue without really much coating on the tongue to speak of. And it just looks red and hot and dry and cracked open like a desert, right? So the kidney yin deficiency, it's making things so dry in your body that you'll also notice other signs of dryness around the body. Like you'll have vaginal dryness much before menopause. You can have the dry skin too. That's more of the blood deficiency thing. But you'll have usually lower back pain or a weak lower back, knee problems where your knees just get injured easily or they're sore and weak all the time. You will have more of an anxious presentation about your moods and emotions. You're like a high energy, high anxiety person. And you'll probably have trouble sleeping. Like you'll wake up a lot in the middle of the night, usually hot and thirsty. And your dreams will sometimes be wild with actually either of these two patterns. So that one's not super helpful with differentiation between the two, but it is something that happens with both of those. So wild dreams, sleep disruptions. Yeah, so those are the main things that I would say would give you a hint outside of the reproductive system. And then within the reproductive system or your monthly cycles, if you have kidney yin deficiency, you usually have short cycles. This ties back to ovulation sometimes not happening or not effectively developing an egg enough. But as a result, you have short cycles. So when someone says, oh yeah, my cycles are always 23 days, I'm like, kidney yin deficiency is probably where we're going to start looking at that. They can actually bleed a lot or very little with this. So the amount of blood doesn't really tell us whether it's kidney yin deficiency. There's something about getting really dry in the body with that yin deficiency that leads to heat. So if it's like a desert, again, so it's the best analogy is like when you get so dry, then heat is generated from like the dry grinding essentially. And then the more heat that you can develop from this, the more it starts to fry things out. So then you're drier and then you start having actual heat signs as well. So this is the presentation of hot flashes with perimenopause, right? The hot flashes, the hot sensations, the cheeks right here only will be really red. So not your whole face, but just like the apples or the cheekbones area will get really red, especially in the afternoons. So there's these very little specific signs that we can look for around the body that are both like full body symptoms or very reproductive organ monthly cycle type symptoms that can tell us which thing it is that's causing it. But the liver blood deficiency and the kidney yin deficiency, those are the two, I would say, most common patterns of imbalance that would lead to the ovaries not having enough nourishment and enough liquid in there to develop the follicle and to nourish the egg and to make sure that there's enough uterine lining to catch it and all those parts of the cycle that are so important to fertility and to not just falling pregnant, but keep a healthy pregnancy continuing. There's also a little more that I do want to mention, just because I feel like if someone's listening to this and they're like, boy, that's not me at all, but I have these type of diagnoses. So this one is rarer. It's not nearly the most common reason for these types of diagnoses. However, it does exist and I do see it. So I will talk about it briefly too. This one has to do with your chi. Okay, so your chi is like the energy movement part of your body. Your chi moves everything around that's supposed to be moving. So anytime there's an action in your body, like ovulate, that's an action, right? It's a verb. That takes chi, energy, power to do it. So if you don't have enough chi, you can't pop that egg out and it can't get to where it's going. And then sometimes your chi is stagnated. So you might have enough of it. You might have enough energy or enough power to move everything theoretically, but you're so stagnated. And usually that comes from stress that it stops the motion like this. So your chi is enough and it's moving. And then all of a sudden, it's stagnated, right? From usually, again, stress. So if that happens, then we see this blockage of ovulation. So things might look good up until the time it's supposed to pop, and it's just not. So maybe your scans early on in the month will be like, yes, you have a dominant follicle. You had enough power, enough nourishment, and that sucker is going to go any minute now. And then it just doesn't make it, or it doesn't work out. And you don't really have an answer for what happened. Looking so good on the early scans in the early part of the month to like suddenly at ovulation, there's just not enough power or there's not enough free flowing of that power. The chi is blocked and then it can't continue with ovulation. So the chi deficiency or chi stagnation is like this third option that might be you that would also contribute or cause these things. And that would then come with an entirely third set of options for how we would resolve that issue and help you to improve your egg quality and improve your ovarian function.
It's all very much in the deficiency side of things. I know in previous conversations we've had, we've talked about blood stasis and dampness and a few other different things, but this is all very much in that more deficient side of things. And then when you look at what the actual problem is, low egg reserve, low egg quality, it's again in that deficiency side of things too. That's super interesting for me. And you mentioned
gold star for you. Like,
we've definitely had enough conversations about this now. Okay, there's definitely a theme going on here. And it's really interesting because you've mentioned perimenopause and menopause. And I won't derail this because I know that this isn't a conversation around that. But a lot of the things that you're mentioning here are very much in the menopause, perimenopause wheelhouse as well. It's like that deficiency, which would then indicate to me that obviously if you are going through that period and change of life, which people listening to this probably wouldn't be, but good to know for future, that you can certainly use traditional Chinese medicine to help in that transition as well. So that's very cool. But moving back to low egg quality, low egg reserve, you mentioned previously how you treat this depending on the different pattern of imbalance. That would obviously be different. Can you give us a little, I don't know, some tips or pointers on how you would actually treat these three different types?
Yeah, especially because they are all deficiencies. So the treatment strategies are more similar to one another than some other things we've talked about where, with PCOS, you might have an excess condition causing it or a deficiency condition causing it. And so our treatment strategies would be so wildly opposite for each other, depending on what caused PCOS. However, with these types of conditions, with the egg and ovary function, like you pointed out, they're all about low functioning and low nourishing. So all of these patterns of imbalance are basically deficiencies, which we can talk about in a more general way. So where I would still definitely break out and do more specialization with the exact foods and the exact herbs and the exact breathing or movement techniques I would have people do as we draw from the 5 branches of traditional Chinese medicine, especially acupressure points. Those would all be different for those 3 different imbalances. But in general, we can give a lot more general type tips in this discussion than I can in most discussions. So the reasons that people are deficient in blood and yin, let's start with the first 2 together, like the kidney yin and the liver blood, those 2 deficiencies go hand in hand a lot because they happen due to similar reasons. That the yin deficiency will usually develop if you are overtaxing yourself. So this is where I see the marathon runners. This is where I see the extreme diet obsessed people where they're counting and they're tracking and they're measuring and they're exercising at the gym every day or they're running every day. These people are the ones who burn out too quickly. Okay. And I don't mean that in a bad way because you can do all the things in a moderate way without burning yourself out or taxing yourself too much. But it is so common to see this. So when women come into my fertility practice or now into my fertility coaching work and I start asking them about their lifestyle, that alone usually tells me which one of these things it is. So if they are, and we have things called the 5 taxations in traditional Chinese medicine that are so long standing, we know if you do too much of this organ is going to suffer, too much of standing or walking, your kidneys are going to suffer and it's going to lead to kidney yin deficiency. So someone who has a deficiency in the kidney system already, which runs all your reproductive organs and fertility, doing more things that are on your feet, like running, is not it for you at all. So I need to tell those people, stop with the running. Just do more restful things, right? So when you're yin deficient, the whole key for your treatment plan on all 5 branches of the medicines is rest and replenishing and nourishing. So we want to focus on you eating really nourishing foods that are actually quite dampening to the body. So these would be the women who get to really ramp up some of those foods that everyone else is being told to minimize. So I'll have them eat a lot more dairy, definitely meat, but meat for the blood deficient people is even more important. But for the yin deficient people, dairy, eggs, meat, these are the huge helpful things to replenishing your yin. If you are dried out and your tongue is little and red and full of cracks with no coating on it, and you're having ovulation or egg problems, this is a glaring, huge flag. Okay, you need to eat these wet, nourishing foods. Pork would be the best meat for that. So I get to tell people more bacon for you because it's very specific to what their imbalance is. It's not because all those things that I listed are healthy for everyone, certainly not for some people, but they're very helpful for yin deficient people, especially kidney yin deficient people. So they need to focus on eating all sorts of like soups and stews and just really warm, really wet dinners. All their food needs to be cooked and hot and gooey and wet and cheese melted on it. This is perfect for this person. Certainly can do it in other ways, like more bone broth or something that would be more in line with the current fitness and diet trends. But the food is huge for these deficiency people. Okay. When we've talked about other conditions in the past, we've talked about excess patterns, and that means a lot more limitations and a lot more of the restriction sides of foods, right? Whereas now when we're talking about these deficiency patterns of imbalance, it's so much more about the adding in. What are you adding in to your lifestyle and to your you need to be adding in a lot of self-care, a lot of carving out time for rest, a lot of sleep prioritization, a lot more cooking, more like these nourishing, soupy foods that maybe you're not accustomed to taking the time to make. The calming things that you can work into your life, like going for walks instead of HIIT training at the gym. Things that are more calming are right for this type of person. The acupressure points that I'll have the yin deficient person do would be things on the kidney channel. So in the inner ankle, I'd have them doing kidney 3 every day, a few times, and massaging that point on the inner ankle because kidney 3 is so nourishing to the whole kidney system and will help all fertility concerns, especially those that are related to kidney imbalances. We could do the liver blood deficient people now. This is not going to be wild different, but there are specific things that I would change for this person. If they were all liver blood deficient, then their foods will similarly be in that warm, cooked, hearty stew, meats family of foods. That's the focus. These people I would have focus mostly on meats, especially red meats, including not just beef, but lamb is a really good one for this. And berries. So all the red and purple berries and red and purple fruits are excellent for building blood. So it's like an easy reminder. Is the thing red? Then I'm going to eat it to build blood, right? So beets, red beets are actually as effective at building blood as beef. So when I do occasionally get someone who cannot tolerate a lot of meats for any reason, I can still work with them for liver blood building. It's a little bit more complicated if someone's not eating any meat. Even if they eat chicken, that's fine. But if they don't eat any meat, it is a little more complicated to build their liver blood. This is a common pattern of imbalance that develops for vegans or people who did even a vegetarian diet, but especially a vegan diet anytime in their past, especially recently, or if they're currently doing it. I'm like, this is the exact problem. This is why this happened. Just so, I can be very clear about it. You are not eating any of the foods that build blood. And so now your diagnosis is blood deficiency. This is extremely clear, right? So that in and of itself gives people, I think, a lot of buy-in power mentally when they're like, oh, okay, my tongue looks exactly like she predicted it would look when I told her that I've been eating a vegan diet for the last 2 years. And I'm having the exact signs and symptoms that she said I would have from eating a vegan diet for the last 2 years. So while a vegan diet can be appropriate for some people with certain patterns of imbalance for short periods of time, that's pretty rare compared to the general population, where I find most of my time working in fertility, encouraging most women to start eating more meats and more red meats and things like that. General food tenets will be the same for this. So like all cooked food, all warm food, especially that like really slow roasted, like pot roasts and carrots in the oven all day type of meals. That's what I want these people eating all the time. For their snacks and their fresh, quick foods, it can be all those berries we talked about earlier and cherries and things like that. The acupressure points that I would have them use to build blood would be especially things like spleen 6 on the upper inner ankle. The spleen 6 point, if we massage that point daily on the inner leg, then it really stimulates the uterus tone. So it's helping build that uterine lining as much as it is helping to nourish the egg each month. So it's hitting all those categories that we saw all month long impacted by a liver blood deficiency. By massaging spleen 6 every day throughout the whole month, we can really help to build blood and get the blood where it needs to go as well. It directs your blood to the reproductive system in many ways, which is super helpful. There are other even more things that we can do, since there's always the 5 branches of traditional Chinese medicine for as far as what our methods are of treatment. So I always talk about acupressure or acupuncture if you go to an acupuncturist locally. I always talk about food modifications. Those are huge. I usually will talk about what type of exercise is appropriate for this. Again, slow walking, light yoga, things that are increasing circulation but not overtaxing you. We have to keep in mind with these types of conditions and diagnoses that deficiency means we need to nourish, not overtax. So anything that seems extreme to you is probably not the ticket for helping improve egg quality. Certainly don't want to encourage things like cold plunging or anything like extreme temperatures like that. Fasting is another big no-no for this. Okay, so no matter which imbalance you have that is contributing to poor egg quality or poor ovarian function, we do not want to encourage fasting, really, of any type. And that's not to say that you can't do it periodically throughout the year if it's part of your religious tradition and things like that. Those are very time tested and those are fine. I'm not talking about those. I'm talking about, I think I should do intermittent fasting 20 hours every day because I read that it was awesome and trendy. No, not for you if you have egg quality problems or ovulation issues, certainly. There are herbal formulas as well. I guess the final branch or treatment method that I would employ with these women would be herbal formulas that have been used in traditional Chinese medicine for hundreds to even thousands of years, some of them. And they are all whole things. So we don't really do chemical isolates like vitamin this or this exact molecule that's extracted or made synthetically in a lab. We don't do any of that. We do like the whole entire turmeric root or the whole flower of the chrysanthemum. Things that are very like naturally occurring and whole. And they're combined in these perfect, beautiful balances that address exactly your pattern of imbalance. So, for example, I would never give an herbal formula for ovary dysfunction. That doesn't exist. I would give one for liver blood deficiency if that's what's causing your ovaries to perform subpar. I would give you a different herbal formula if you had this more rare but a chi issue with your ovulation. That would be a totally different strategy for all of these methods I've mentioned. So everything has to be customized and everything has to be dependent on your own unique pattern of imbalance. And unfortunately, the twist here is that so many of us have more than one pattern of imbalance going on at the same time. So whether it's something that's related to your ovarian function or not, it's still in you. And so we still always need to be aware and cognizant of what order the body would like us to deal with these imbalances in. And if we listen to that, we can effectively help you resolve all of your patterns of imbalance, not just one or the other, which I think is really important for long-term sustainable results.
And I think for anybody that's interested in those order of imbalances that Julie just mentioned, we did a huge deep dive into all of those in our very first episode together. So I will probably put that in the base of all of these episodes as well. So you can keep an eye out for that too. And if you're interested in that, I definitely recommend you watch that or listen to that episode. And you know me, I'm always making notes while we talk. It's really interesting that, and anytime I talk to you, I'm like, it's really interesting. I feel like that's the first thing that I ever say. I'm like, interesting. Wow. But you've mentioned the 5 taxations, and I'd really like to dive into those because that's just something new that we haven't really discussed before. But it's also interesting that you mention cold plunging and fasting, intermittent fasting, because that's definitely something that I feel in the wellness, health and well-being realm. Intermittent fasting has definitely increased over the last, I don't know, 5 years, I would say 10 years. And cold plunge in the last, say, same kind of time have really increased as well. And I feel like the cold plunge, with more research, I think people are starting to see, if they're using it in terms of post-workout, that it's not as efficient for muscle building and recovery as they previously thought. But when you look at it in terms of fertility, it's really interesting to see that these well-being practices that people are really pushing and have been for a while can actually have a detrimental effect on people with these patterns of imbalance.
Yeah. And again, it comes back to individualized care plans because there is a time and place for cold plunging, for example. And that time and place is what I would call stage 5, which is after we have gone through your body and we have eliminated all of the excess buildups of sluggishness that are throughout your systems. And then after we have gone in and assessed you for any deficiencies that you have, and we have helped your body to naturally nourish and fill up your cup and consider you done if there is such a thing. Like you don't have any marked patterns of imbalance. And now you're in a place you want to challenge self to become even more optimized with your health, which means also your fertility, of course, because fertility is simply a marker of health. So you can get to that point, and then cold plunging can become a part of your long-term self-challenging, building resistance type of plan, but it is not recommended if you are someone who has these patterns of imbalance that we talk about. So if you have a lot of excesses, if you have a lot of deficiencies, your body will not from you taxing it more extremely. So to your original question, the 5 taxations, it's not specifically talking about the plunging. However, the entire body of 3,000 years of traditional Chinese medicine is basically, if I had to sum it up, is avoid cold and always be warm. Conceptually speaking, for us acupuncturists, cold or icing something is just not it, okay? Not beneficial in most cases. The other taxations, if you want me to walk through those quickly so you can see what we
I'd love
mean.
you to.
Right?
Yeah.
Okay, so the 5 taxations that we've historically noticed, each one is about something that we could do too much of, basically, and then it affects a certain organ system. So in traditional Chinese medicine, we would say the organ name, but we capitalize it. So it would be like the liver with a capital L. And for us, that means the actual liver plus all the functional things that the liver does in the body. So it's like the liver type of thing. Okay, so when I say the organs that it injures, it doesn't necessarily mean that you would go get a test on that organ, something wrong with it in Western medicine. It's really about a functional system of that organ. Okay, so the first one is you sit too much. Excessive sitting weakens your spleen chi. So your spleen chi is that core digestive fire of you, the power that runs digestion and metabolism in your body. And it's responsible for both absorbing your nutrients and utilizing them, and then also eliminating effectively. So having nice formed stools every day that eliminate the waste products. So if you're sitting all the time, your digestion suffers. So when we think about this in application, it makes sense, right? What do we say to do after dinner? Go for a walk. So that we stimulate digestion with our little postprandial walking. So that one I think is pretty easy to understand. Some are clearer than others. So the second one is prolonged standing or too much standing up, which can also be like too much walking. So I tell people if you're a nurse or a server, you're always up on your feet, basically, whether you're standing still or walking, this can apply to you. So this will injure the kidneys, especially the joints and bones, which are also run by the kidneys for the most part. So if your job is a server or a nurse or somewhere where you're always on your feet, then you are at risk of injuring the kidney system, which is a huge deal because the kidney governs reproduction. And if anyone's coming for fertility, they don't want to overtax their kidney system because they don't want to reduce their fertility. Okay. So if that's you, when you come home from work or you don't have to be standing anymore, it's important that your exercise style is not standing and running and walking. It's something that's seated or something that's laying or something restorative like yoga that's more in a laying down position rather than like running or doing the Stairmaster, for example. The third one is excessive laying down. So if you lay down all day, you don't have to be sleeping per se, but if you just like you come home and you're like, I need to lay down on the couch or lay down in my bed all the time whenever you can, this will make your chi sluggish. So it will lower your chi and contribute to chi deficiency. It's almost like a little bit of you need to stimulate yourself in order to have energy, which I think is also pretty easy for us to understand because when people say, oh, energy, one of the common things we suggest is get outside and go for a walk or do a little exercise. If you think you have any energy, maybe try a little exercise to stimulate your chi. So it helps to not be always in horizontal position. And in fact, when someone says that they always need to lay down, and especially in the fetal position, that's like extra laying down to us. Like extreme laying down is when you feel like they need to curl as well. That tells us technically that you have usually a kidney yang deficiency because it's one of the signs that we ask for. Yeah. So you don't want to lay down or kidney chi deficiency too. I'd say it's more about the chi, but sometimes the yang. We don't want to lay down unless we're sleeping. The fourth one is the eyes. So and this one is actually my favorite one because I think it's very cool. It's like physical and conceptual. So too much use of the eyes. And it's so applicable, right? Because what are we doing? We're all staring at screens or staring at paper books even, or something. Like, we're always using our eyes. I feel like from the moment we wake up to the moment we go to sleep, we're straining our eyes. And this specifically affects the liver blood. So this is one of our main imbalances for poor egg quality, or low ovarian reserve, or all those things we're talking about tonight. That's liver blood deficiency is a huge one. The other part of this, using your eyes too much, is the more conceptual part of looking. So this is like always looking for the next best thing, always looking better, looking for something more. So are you physically using your eyes when you do those types of things? Sometimes. But sometimes it's really all about almost like your thoughts, right? If you're always looking for something next, new. And this really applies a lot to my fertility coaching clients, because they are trained to be looking for that next new shiny object all the time. The next fertility tea, the next fertility exercise, the next fertility hack, the best fertility supplement, all those things. So that can really work against your liver blood and tax too much. Okay, so we got to worry about that one for fertility, especially for these deficiency things that we're talking about. And the last one is like a catch-up, I would say. So it's in general. So this could be like that person, again, that's like the marathon runner that also does the HIIT days a week, and who's just constantly going or really capping out how much they're eating in certain ways, and they're just very like straining the body, and it's overusing. This mostly affects, it's like a combination of kidney and liver is what it affects. So it affects your kidney system and your bones, and then it affects your liver system, which is more of like the sinews and the joints stuff, connective tissue. So we don't want the kidneys, and we don't want to injure the liver when we're talking about fertility. So this whole like over physical activity thing, it can be exfoliated, like I keep mentioning, but I don't want people to think it's only exercise doing this overexertion. It's also too much sex, drugs, and rock and roll, we call it, right? Where it encapsulates like all the vices, all the bad habits. So if you stay out and you get drunk a lot and you do a lot of drugs, or you even have too much sex, is actually in the classics, where it's like there's a schedule for sex, and there's a schedule for like how often, especially for a man, they should have sex for vitality and for optimal fertility and health and function. And if they go way overboard, this is what it will do. It will tax their kidney and liver systems. So that's when we see the lower back pain, vision problems of the eyes, and all those other symptoms that we mentioned earlier. Because we haven't really said this lately, but I think I said this the first time we ever talked, which is that all of these patterns of imbalance can affect women. They can also all affect men. So sometimes there's slightly different signs and symptoms. We don't have the period cycle to look at for information, but other than that, they manifest in very similar ways. So we don't want to overtime, because I think right for the organs we mentioned the most in that little side discussion were kidney and liver, and those are our two main ones for ovarian function and egg quality.
I've noticed, again, we've been talking a lot in that yin area as well. I think you've only once mentioned yang. So there's obviously something in that as well.
Definitely. Every person is a combination of yin and yang. And then within that, each specific organ is a blend of a certain amount of yin versus yang. So some organs are very much wet and heavy. They're much more yin, or like the liver. Some organs are very much airy and like sacs or tubes, and those are very much more yang. They are about movement. Your food's out, like your intestines. So there's a lot of things a lot of differences in yin and yang in each organ. And we don't want to, one is not better than the other. So we never want to just tell people like, oh, eat all these foods that are yin rich. That's only if the person is deficient. It's always about what is the perfect combination. What is the balance of yin and yang in you and in each of your organs? And when that balance is achieved, that is the state that you are absent of patterns of imbalance. That's perfect. That's when you can move on to those like cold plunges or intermittent fasting sometimes, or any of the things that are super taxing and challenging, because you're so good that you want to increase your good and become more resilient and even stronger than good and normal and average are have you at. Then we can go for those extra things.
Now, if we look at Western approaches and Eastern approaches, how can you integrate those for people that do have low egg reserve or low egg quality?
Yeah, again, I think it comes back to those general suggestions, which we do get to make in this conversation compared to most conversations where it depends. It's so different from your pattern of imbalance versus this. If this is your pattern of imbalance that caused your condition. So in this conversation, because it is all about deficiency and it is very about the yin and blood deficiencies, and blood is our main form of yin. So we didn't really get that deep tonight. Yin is everything liquidy in your body. Blood is the most liquidy thing we have in our body. So blood is it does overlap so much yin, right? So when we talk about what would be real strategies, it tends to be the things that I would say from Eastern medicine do align a lot with what Western medicine might suggest for these conditions. Although they say there is no cure for this or that there is no real treatment for this other than using donor eggs if you want to have a baby. Otherwise, it's exactly what you mentioned earlier, where they just say, oh, it's early menopause. And that's actually one of the other names for this is early menopause. So they would just let it go and say, roll of the dice, you're having menopause. But those doctors who do want to take steps to try with their patients in Western medicine to help see if they can improve their egg quality or their ovarian function, they would be giving similar things to what we give, which is make sure that you rest more, make sure that you're doing things that are calming, do things that reduce the stress load in your life, because we know stress hormones are interruptive to our reproductive hormones. And we don't want to be all cortisol and adrenaline. We want to be progesterone and estrogen, right? So we want our hormone building blocks to go to the appropriate end products, end hormones in our body, not all be stuck over here on one side. So it's all those types of things like meditation apps. Make sure you prioritize working on sleep hygiene, not having electronics in the bedroom, doing gentle circulatory exercises like going on walks or things that are like good for everyone as far as exercise goes. I should know the answer to this, so I'm a little embarrassed that I don't, but I feel like there is probably research out that shows that acupuncture improves your egg quality for people who are not doing assisted reproductive technology, because all the studies that I am aware of and that I'm familiar with in this way are specific to IVF. So like one is preparing for egg retrieval, for example. There's tons of studies that I show my patients time that are like these needles and these things this many times before egg retrieval and before increase your outcomes to 60% in all these different studies. So it's very cool research that does exist, I know for sure, that shows in an indirect way that yes, these TCM does improve your egg quality and your outcomes. But what I haven't been familiar with is there a lot of research out there that just shows in general and who's maybe not even trying to conceive and just simply wants to regulate their cycles or improve their ovarian function, like without the intention of ever conceiving. I don't know that research is plentiful, but I'll have to look now. But I think that it would show that because I know how it shows that with the assisted reproductive technology studies. But my point in saying this is it's becoming much more common now for Western medicine doctors to refer their patients to doctors of acupuncture or to acupuncturists in general so that they can benefit from what acupuncture is showing. I always jokingly say this, but it's actually quite true and serious that Western medicine is catching up with X, Y, or Z, because it's like these are things that we've known for 3,000 years in Eastern medicine. And it's just now coming out, Western research. And when they discover something, it's like mind blowing to them. Like I keep seeing these things this year that are all about like nervous system dysregulation is the root cause of infertility. And I'm always like, yes, obviously that's something we've been working on. And we call it chi stagnation when your nervous system is dysregulated. So we do that as well, stage 3 when working with patients and coaching clients now to improve their fertility. Stage 3 in our process is all about regulating your nervous system because this isn't new and trendy. This is something that we've observed in millions of women for thousands of years. So it's fun to see those like overlaps now between Eastern and Western suggestions. But I guess what I would more women to know is that Western medicine is not ahead in those ways. Okay. I truly see that Eastern medicine is ahead in those. You don't have to wait for Western medicine or modern research studies to reprove things that we are already doing in practice and seeing the evidence in observation in millions of people. So it's out there if you are willing to look and if you're more open to what's being called the ancient wisdom and the natural medicine. It's got it all figured out already for the most part. And it's beautiful to see it work and to not be affected every new little thing that comes out, every new little finding or things that get reversed every 5 years, like eggs are good, bad. butter is good, butter is bad. Like, we don't have to worry about any of that little like changing, trendy, shiny object syndrome, bouncing around stuff. It's very unsettling to the nerves to be caught up in those types of trends. So to operate in a system that has been observing and doing basically these things we know work for thousands of years, very calming and very reassuring. And I think that what women like the most, who I work with now with fertility, is that calm plan. Oh, you do know what's causing this, and your system does understand why. Oh, we can resolve it and then prevent it from coming back, because those are things that Western medicine just is not able to answer for people for the most part. That's why unexplained infertility is the biggest diagnosis for infertility right now.
And I think you've just brought us into a really beautiful closed loop. We've just come really succinctly back to that. Why, what can you do about it? Or what's going on? Why? And how can we fix it? And I just think it's a really beautiful place to finish there. But of course, with one last question, and I know you've answered this before, but what's the one thing you wish all women knew before having a baby?
Something super interesting that I just keep coming up recently. So I thought, this is the thing I'm going to say. Okay. The idea that you have to allow your newborn baby to get K injection in the hospital is becoming quite controversial, which I always try to operate by the theory of, is that the natural way of things? If not, then we probably don't have to do it, right? There's a reason that the way they are in our human design. So what they're now finding is that when a baby is through a bit of trauma coming out of the birth canal, or even with cesarean section, there's different little micro injuries, right, to the baby being born. And so the point of the baby cord blood is to be able to circulate after birth and travel to all these parts of the body, heal all those little micro injuries. And when we inject vitamin K, the blood clots. And that's why they're doing it, so that if you get in a car accident on the way home, your baby will clot and not succumb to bleeding out, which is a great idea in theory. That's doing as the side effect is that it's preventing the cord blood from circulating and getting those stem cells to the areas of the body that needs to heal and to start repairing those things. So the assumption that we have to do it in the hospital is something that I would say we look into just a little bit more, the other side. And that's something that I was never told, and that I would like to tell all women before they have a baby.
And I guess that opens up the whole conversation around cord blood in general, because I know that there is a practice where they don't actually let the cord blood drain into the baby. And I know that's something that I talk about in the pregnancy process as well. So that's definitely something that I would agree that you look into if you are currently pregnant and you're about to have a baby, or even just make a little note to look into the benefits of cord blood, and I guess some of the practices that don't allow the baby to get the cord blood in your more common medical birth centers, I would say.
Cord blood clipping is another thing that is very important, and that you mentioned too, is that why do we cut and clamp so quickly? The blood needs to do a little more work after.
That's such a great conversation as always. I feel like I'm getting so much more knowledgeable about this stuff. It's like I'm absorbing your knowledge, and I just thank you so much for all of your input and time and energy and just sharing all of this incredible information. So thank you once again for being on here. And I feel like we've covered so many amazing areas of women's health this season. So yeah, thank you so much.
Well, thanks for the opportunity to spread some of this to more people.
And if you're hearing this message, I want to say a huge thank you, because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode, or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process.